So, Dr. LaKeshia Green, thank you for joining me today. My name is Chase Jackson. I am the National Service Partner Chair for the March of Dimes. As a part of my duties, I wanted to have an interview session with you as a part of Jack and Jill, just to interview about who you are, who your organization is, and how you've raised funds for the March of Dimes and your excitement around this great cause.
Okay, sounds good. Thank you for inviting me.
Yes, ma'am.
Again, my name is Dr. LaKeshia Green. I'm a psychiatrist at Parkland Memorial Hospital, and I also teach at UT Southwestern. I teach psychiatry residents. And so I've been a member of my organization called Jack and Jill of America. Specifically, I'm part of the Northeast Dallas chapter for roughly about 3 years or so. And so we're a fairly large organization. It was started in 1938, and it's an organization of African American moms who our commitment is to community service, social justice, and also developing our children into future leaders of America. And we have been actually partners with March of Dimes for the last 75 years because their motto is healthy moms, healthy babies, and which is essentially a commitment to families. And so that aligns with our organization commitment to families as well. And so it's a really important organization that we donate to. We last year we raised roughly about $1,500 for our organization on behalf of March of Dimes, and so this year our goal is about $5,000.
Okay. No, well, that's fantastic. You said 75 years?
75 years.
That's a long time to be doing a lot of good.
Mhm.
Very nice. So, Dr. Green, what got you involved in raising money specifically for the March of Dimes?
Yeah, and so I just want to also clarify
Mhm,
my specific chapter has only been in existence for the last 10 years.
mhm.
And so with Northeast Dallas, we've been part of Merchandise for the last 10 years, but the
Perfect.
organization nationally has been for 75. Me specifically, being a mom, I did have my son at advanced maternal age. And so with March of Dimes, they do a significant amount of research into Black maternal health. And because of them, we know that African American women are 3 times as likely to die of pregnancy related conditions, no matter what their socioeconomic status is. And so, specifically with me, with my son being advanced maternal age, at the towards the end of my pregnancy, I had an extreme spike in my blood pressure that was at a level of stroke levels. And so, thankfully, working with my OB and the team, we were able to deliver my son healthy, and that I was okay. I think in any other instance, if my OB wasn't as attentive as she was, it may have been another outcome. And so, with March of Dimes, they're really trying to understand why does that statistic even exist, again, no matter what the socioeconomic status is. So I'm really passionate about donating to the organization, in particularly because of their advocacy of trying to understand why this statistic exists, and as it relates to my culture.
And thank you for that, Dr. Green. And yeah, it's true. So, healthy mom and babies, they don't shorten one end of the stick. So, healthy mom is definitely very important. Attentive doctors for all of the health issues, if you will, or symptoms needs to be taken care of. So, grateful for that attentiveness. Is there anything else you want to add before I close out our interview?
No, I think that's it. Again, I really appreciate you having a platform for us to discuss all that March of Dimes does.
Yes, ma'am. Well, thank you once again for agreeing to do this. And hopefully this will bring a brighter light and shed a more positive light as far as raising funds for our respective causes.
Sounds good.
Alrighty. Well, thank you, Dr. Green.
Thank you.